My name is Dr. Otabor'S Christopher. I'm the medical director of Alliance Hospital here in Abuja.
Thank you.
Thank you. Today I'll be talking to us about prostate enlargement. This condition affects everybody, almost everybody, in one way or the other. Even though the disease is a male disease, it affects male. I mean, it's male, the men that suffer from it, but women are affected. Yes, because every man is either somebody's father or somebody's uncle or somebody's husband.
Okay.
So one way or the other, both men and women suffer the consequences of this disease. 20,000 men die from prostate cancer every year in Nigeria alone.
Huh? Not the whole world.
No.
20,000.
Yes.
Die.
Yes. That's about 54 men die in this country every day from prostate cancer. It's very common. It's the commonest cancer in men. So it's a big problem. There are two types of prostate enlargement. There is the one that we call benign. It's not cancer, but it can also be a problem. Then there's the one that is cancer, which is prostate, cancer of the prostate. As the prostate gland is a small organ like walnut, is sitting at the neck of the bladder, just below the bladder. And the pipe that takes urine from the bladder and the pipe that takes sperm also pass through the prostate for it to go out. So the function of the prostate gland is to produce fluid that helps to lubricate the semen for it to move freely. It also nourishes the sperm. Now, as we get older, especially from around the age of 40, naturally the prostate gland increases in size. Imagine from being a walnut size, and it can get bigger and bigger. It can get to up to 5 times the size of walnut. It depends on the individual, the genetic predisposition, and all that. And that increase in size has consequences. Don't forget that the pipe that carries urine passes through the prostate gland. So if it increases in a certain way, it can compress that pipe that passes urine, that takes urine out.
Why the pipe no go shift follow another side?
You know, the shift. It's constant.
Okay.
So the pipe of the urine will be collapsing until it becomes very narrow. And that's what leads to the symptom. You will notice that in some men, they used to get up to pass urine once in a night, or they don't even get up before. But since their prostate gland began to enlarge, they can go and pass urine up to 4 or 5 times a night. Okay. Yes, it's not diabetes.
Now, waiting we've been the thing before.
Not necessarily.
We go they urinate every time like that.
For diabetes, the difference between diabetes and this one is that in diabetes they are urinating plenty volume because they are drinking a lot of water to dilute the sugar in the blood. So whenever they go to urine, they will urinate plenty. But for prostate enlargement, when they go to urinate, they will urinate small. Okay. And there are other symptoms around that. Sometimes you get to the toilet, you are waiting for a long time, urine is not coming out. We call it hesitancy. Okay. After some time, it will come out.
And now that thing we've been here, say people will suffer gonorrhea now waiting, then they see.
Yes, that one can also, gonorrhea, complication of gonorrhea when there's urethral narrowing can also behave like that.
Okay. Yes. Now you call hesitancy.
Hesitancy. Yes, that means
the thing they wait, they delay.
Yes, now you feel like going to urinate. You get to the toilet. You want to urinate, it's not coming.
The urine no go green.
Yes, you are waiting.
They do
20 seconds, 30 seconds, 1 minute. Then before it now start coming, because the pipe is narrow now. Okay. Then that frequent urination is because you are not able to empty your bladder at once. Within another 1 hour, more urine has reached the point where it will irritate the bladder. You want to pass urine again. Yes, and then straining. Some people will be straining for the urine to come out is difficult. All those are because the urethra has been now compressed by the enlarged prostate.
Okay.
Yes. Sometimes dribbling. You want to pass urine. You know, small boys, when they want to pass urine, they can wire their urine to a long distance from them. But as people get older and their prostate gets enlarged, sometimes the urine will just be dropping before them. They can't make a stream again. Yes, so that is because the prostate gland is compressing the pipe that urine passes to come out. Then that's for benign prostate enlargement, the one that is not cancer. But for cancer, all these things may be there. In addition, the man can also bleed from, he can find blood in his urine.
Oh, blood inside the urine.
Yes. Then he can also be having waist pain. Yes, though there are many causes of waist pain. But this one, it might just be because of the cancer that has spread to the backbone.
Okay.
That is now causing the waist pain. Because that's why when we are evaluating men that we suspect to have cancer or prostate enlargement, we do a lot of tests to be sure where we are. Sometimes blood can also be in the sperm. After the man meets with his wife, he just noticed that blood is there. And even there might be pain during ejaculation or erection.
Pain during ejaculation or erection.
Yes,
Doctor,
or
just hold
there
on
might
there.
even be inability to have erection.
Hold on there.
Yes.
Olajide Samuel, he say, I beg doctor won't kill me with English. Which one be prostrate and where it dey for man body? Can someone help me? I want make I quickly say this one. Medical terms sometimes no fit get broken English. But I believe say doctor go fit explain and where everybody go understand. In been done explain this, but just for the sake of this, doctor, you fit just quickly explain where it dey and waiting it be. But no bother about breaking down as they talk, because some medical terms you no go fit use broken English. If you fit use broken English, if it mean a different thing altogether. The one where you they talk, majority they understand. The ones where no understand, make them ask. And a part of the reason why I've been talk say you go tell us where you dey in case.
Okay. Okay, thank you for that. The prostate gland is just at the neck of the bladder. I don't know whether he also knows bladder. Yes, the bladder is the container for urine before it comes out. That's the bag that the body receives urine from the kidneys.
So it dey on top of above
below the navel.
Below the navel, inside
the body. That is where you have the bladder.
Now the last thing where you go see when you begin come down before the pipe and the 2 jerry can.
Exactly. Yes. So below the bladder, at the neck of it, before the pipe starts, that's where the prostate is located. And the prostate is prostate, like you said. We can't break
all
it
of
down.
that now for area 1 then there.
Yes, that's headquarters area. Yes. Yes. So, but it's deep inside. Yes. And that's why it's difficult sometimes to know that there's a problem with it.
Okay.
Because it's deep inside. You won't see any problem except the symptoms. So, all those ones symptoms of, then there can be weakness. Some people, they just come to the hospital, doctor, I could not move my legs again. That's the first time they are coming to the hospital with a complaint. My 2 legs are paralyzed from waist down. That's because there has been a cancer that has spread to the spine and it has knocked down the spinal cord. So they just discovered that they can't move the lower half of their body and they can't feel anything.
So prostate cancer fit cause that?
It's one of the commonest causes of paralysis. If it spreads to the spine, and it often spreads to the spine. Yes. So how do you diagnose it? From history. Usually the men are middlemen to elderly. You can hardly have a problem of this nature in people below 40.
Okay.
Yes. People who are in their 50s and 60s and above. It's commoner with them. And then they will tell you all these things I have said. They may or may not. That, oh, I noticed that I'm having problem with urine. In fact, some people will just have complete lack of inability to pass urine.
They no go feed the urine.
Yes, we call it urinary retention. Some people, that's the only time they know that there's a problem with their prostate. They just discover that they want to pass urine, they can't.
What thing can happen now for the urine?
So that is an emergency. It's a urologic emergency. When they come to the hospital, the doctor will try to pass catheter to get the urine out. If after several try and it cannot, we will have to open above to get to the bladder and put a catheter there to bring out the urine. Yes. Because for a man not to be able to pass urine, if that thing continues for hours, it can be devastating. It can even affect the blood pressure. It can affect so many things. And then the urine will go back to the kidney and affect the kidneys.
Okay.
Yes. So all the history is important. Then all the things I've mentioned, we'll ask whether those things are there. Then we will now examine the patient. Some men, they are shy when we want to put a finger in their anus to examine the prostate. There's no need to be shy, because if you don't allow that finger there, someone will put his leg on your grave. That's what is said in medical practice. So it's not joke when we say, please, let's examine because through the anus we can touch the prostate gland.
Okay.
It's part of the examination. In fact, if you go for postgraduate exam and you examine the patient and you did not do rectal examination, you will not pass. Yes. Because it means that you are not a thorough doctor. Because when you put your finger there, you can check the size of the prostate. You can check if it is hard like stone. You just suspect that this is most likely to be cancer, because it's supposed to be soft. Okay. Yes. So you examine both the prostate, you examine all the body, even the eyes, and check for the nerves and everything. Then you investigate. A lot of the time, patients come to the hospital and they think, especially specialist hospitals, in some other smaller hospitals, they may not have the thoroughness, the equipment to do the thorough investigations. But if you go to a specialist hospital, they will subject you to a lot of tests: ultrasound scan, X-rays, CT scan, MRI scan. They will take your urine for test, MCS, urinalysis. Then they would also do what we call PSA. PSA is prostate-specific antigen. I've come here before to talk about prostate-specific antigen.
Hold on there again, doctor, because this one where they start now, be like say they answer some questions already. Okay. Moses De Zege Kachi, he say, good morning, Consultant Ike. I am 53 years. What Dr. Otabor'S is saying, I experience sometimes. So what is the solution?
We will get there. Let's establish for everyone. So when we do all these investigations and we have examined the patient, we will be able to tell whether this enlargement, whether it is innocent, in other words, benign, or whether cancer is inside. You see, there are two different things. If it is benign, we will first of all go and celebrate, because it is not a big problem. Okay. It's not as big a problem as if there is cancer. Okay. And the differentiating factor is the prostate-specific antigen.
Maybe that one where you go test for.
Yes, they'll take your blood.
Raymond talk am here. Raymond say, this doctor sabi in work no be small. I had similar issue here in Germany. And that's exactly what they did. They passed catheter through my tummy before an operation was done.
Okay.
Continue, sir.
So the prostate-specific antigen, the normal level, that's what the prostate gland produces normally. The normal level is 0 to 4 nanogram per mil. 0 to 4. If we do it and it's 4 to 10, we are suspicious a little bit, but we are not worried. It's not likely, but it's like it's rising. But if it is above 10, then we must do what we call a biopsy. We will take small tissue from that prostate. It's a small operation to go and check in the lab. But if it is like 50 and above, we're already worried because there's a very high chance that we're dealing with cancer. Yes. Some cancers can be as high as 1,000. So you just know that, look, this one is advanced. The advantage of that test, which every man is encouraged to do, every man above 40 is encouraged to do it at least once in a year, whether you have symptom or not. The advantage of that test is that if the cancer is there and it is early, you can pick it up and do something about it. Unfortunately, most of our patients in Nigeria, by the time they are coming to the hospital to be diagnosed of cancer of the prostate, it is already late. They are already getting complications, either because they are coming because they cannot walk anymore, or they are coming because they cannot pass urine, or they are coming because they are passing blood in urine, and so on and so forth. At that time, you are already dealing with a late disease, and life expectancy from that time, about 70% of patients who come with complications will not be alive after 2 years, no matter the treatment. Yes, it's
My
difficult.
father survived prostate cancer. This is about the 10th year he survived, and he went through all of these processes where you they talk.
Excellent.
Thank you.
Once it is diagnosed early, there are people who are 30 years after diagnosis and they are still okay. But if it is not diagnosed early, then the end is not too far away. Yes. So if folks don't take anything out of this discussion, we should take this out of this discussion, that men above 40, whether your hospital says, whether your company is doing annual check for you, or whether you will do it by yourself, men above 40 should walk to the hospital at least once in a year to say, please check my PSA. There are a lot of surprises. The other time I was here, I organized free PSA tests for people, and and a lot of people came to the hospital to do it.
Oh yes, I remember, because even that one, I come.
Thank you. It was shocking what we found. We found a lot out of, I think we did for 100 people for free. Out of that 100, about 6% had that's 6 out of the 100 had PSA that we consider to be in the level of cancer, and they didn't know. So we had to quickly direct them to the urologist, who started managing them. As many of them are still continuing with their care today. And if they didn't come that time, they waited another 1 or 2 years, it would have spread, and then there's nothing that could have been done much for them.
Now, PSA test, you call it?
Yeah, prostate specific antigen, PSA.
Okay.
Yes.
So, of course, any medical person that know what he's doing, once you tell them, if you don't even remember the name, tell them, say you want to test your prostate. I hope so.
Yes. They will be able to guide you.
Thank you.
Yes. So, like that, that person was talking. You were the one that was talking about diabetes. That those symptoms, they look like diabetes. There are many other things that they look like. If you must differentiate it from diabetes, you must differentiate it from urethral stricture, which comes from gonorrhea. You must differentiate it from UTI, urinary tract infection, and also from prostatitis. So, having established the diagnosis, what is the treatment? The treatment depends on the stage. For the benign prostate enlargement, the one that is not cancer. So, if the symptoms are not too severe, you can give medication. There are many men above 50 who are taking some tablets every day. I don't want to mention the name so that people will not go to chemist and say, give me this medicine. They take it every day. It helps to shrink the prostate gland small and allow them to be able to pass urine. So there are different types of medicine you can take for that. Then,
but it must be on prescription.
Yes, it must be on prescription. It should be on prescription, because the medicines can interact with other medicine or even some food item that can make it dangerous if you don't get it through prescription.
So that kind of thing, they happen?
Yes, they happen. Drug interaction. or even drug-food interaction.
Person they take medicine or drug, or
Yes.
you go they interact with another medicine
Or food. Yes.
Can cause problem for.
Yes.
But
So
a small problem that one.
not be small problem. It can kill. Yes. Yes. In fact, let me give you an example. Men that take drug for erectile dysfunction, they want to perform.
In fact, somebody don't ask I'm here, but I know say no be waiting you come here for today.
Yes.
They say performance, low performance, doctor make you tell them. I say another day.
So if you are taking medicine for erectile dysfunction, that's for performance enhancing medication. If you combine it with some medicine that is given to dilate the blood vessels in the heart, like nitrogen substance. Yes, there are some medications, nitroglyceride and the rest. It can lead to fatal hypotension. The blood pressure will drop to a very low level and the guy can just pass from there.
Don't say.
And a lot of people die from that. Yes, so we should take medicine with all the necessary precautions.
Thank you for that one, doctor.
Yes. So, having made the diagnosis when we have discovered that it is benign, it's not cancer, so there are medicines that the doctors can give. But there are some that are stubborn. You have to remove the prostate gland. So that we call it prostatectomy. Before, it used to be open. You must do an open operation to take it out. But now, is with a laser surgery. You just go in and shave off the prostate, the excess prostate. By the second day, the patient has gone home. In my center, it's the second day that we discharge the patient for that kind of big operation because of technology now.
Okay.
Yes. Though there are still a few, if the prostate is so big, such that laser will not work, you will still have to go and open and remove the prostate, manually. Yes. Then if it is cancer, that is where the problem is. But it is still solvable. It depends on the stage. There are some, I don't know if we can display some slides.
Okay. Make with it. We can.
Okay.
And my screen here has gone off. I don't know what happened to it. Auntie Jessica, if you're here, if you come check.
It's there.
Okay. That's the slide.
Okay, so that's the last one. Go to the first one. So this is the rectal examination I was talking about that the doctor must do for the patient, or is good to do. Go to the first one. The first. Okay, so these are different stages of cancer. The one on the left of the screen is early cancer, stage 1. No, go back to that slide that I'm. Can you go back to the previous? The yellowish stuff inside. See, the bladder is the one that is looking like a glass cup now, like a goblet. Okay, then the one below, that roundish thing below is the prostate gland. Then the yellow structure within the prostate gland is the cancer. Yes. You can see that in the first slide on the left, it is not prominent. The cancer is still within the prostate, it has not broken out. That's an early cancer. The second one is just about to break out. That's stage 2. If you see the third one, the second from the right, you can see that it has broken out of the shell. I don't know if you can see that. So it's going towards the bladder now. The fourth one, it has even entered the bladder. This kind of person will be urinating blood. Yeah, because the cancer has broken, and it can also be urinating flesh because the cancer tissue has entered into the bladder. And that stage 4 is advanced already. Those yellow cells will soon spread through the blood to the spinal cord and some to the brain. It can spread to all over the body. So if you catch the patient at stage 1 and stage 2, you can remove the entire prostate and the patient will be cured. But if it is in stage 3 and 4, you can't do much about cure. What we are just now trying to do is manage it so that it doesn't spread any further and cause much harm. So for stage 1 and 2, you can do what we call radical prostatectomy. You can remove the prostate gland and the patient will be fine. But for stage 3 and stage 4, what is done, especially for stage 4, is hormonal therapy. We usually advise, some of you may have had that advice. Maybe your elderly grandfather or even father went to the hospital, was diagnosed with prostate cancer, and they advised him that they want to take his testes out. Orchidectomy is a standard treatment for prostate cancer. Many men will say, no, I need my testes. But
what thing you go take am do when cancer there already?
Exactly. So if you do orchidectomy, the problem is that the testis produces hormones that feed the cancer.
Okay.
Yes. So if you take out the testis, the cancer will shrink. But there's an alternative to that surgery, which is hormonal therapy. So there's an hormone medicine that you give, which will also knock off the hormones that the testes produce. And that will also shrink the prostate gland. Over the next 2 years, the patient can be very fine. But after 2 years, the cancer cells undergo mutation, and then it can come back again. And by the time
that hormonal therapy no go fit hold am again.
Yes, it has failed. And when that happens, many of the patients will not survive it from there. Yes, but we still continue to treat. There are new medicine now that is given to the patient, to attack the new line of cancer cells that are being produced.
Okay, doctor, one question here.
Okay.
Egweru Efe Redeem Ogele, he said, Doctor, please, I would like to know if lack of sex in a man can lead to this prostate cancer.
Okay, so that is a controversial issue. I remember reading something on the net one time, and some people wrote in support, others wrote against.
I have even seen a video.
Yes.
Where one man, they talk about him like this. So they can't be like, say, they can't talk waiting, no, they're impossible.
Yes.
So if man no do every
21
day,
times a day.
21 times a
month.
day, say you go get cancer.
Yes.
So if you no get wife, or you get wife where
Yes.
nowhere, it means say make you begin a bad life.
So to answer that question, there is no, in medical practice, in science, there are things that everybody agree on. Consensus, that's the word I was looking for. There's no consensus on that. Some people are for that argument, others are against the argument. Some people say, well, the more sexual activity you indulge in, the less your chances of having the
so
cancer.
Means they no get scientific
But some
proof.
other people say, if you are promiscuous and you have infection, it can even predispose to cancer of the prostate. So there's no clear cut. Some people who are scientists support this idea, but others go against it. They say, look, there are people who are nuns, who are celibates.
And they also live and
yes,
die
they live without cancer. So how do you now prove that? So it's still at the level of speculation and theory. Is yet to be proven. Yes.
Okay.
So there's also room for radiotherapy, immunotherapy, and chemotherapy for the treatment of cancer of the prostate. So the complications of the prostate cancer, you have bleeding, urinary obstruction is very common, kidney failure, bladder stone, spinal cord compression, coma, and death. So the prognosis depends on the type and the time of diagnosis and the characteristics of the tumor. To prevent it, good health behavior, avoid exercise is good, avoid smoking, and if you can cut your weight, it also helps generally to reduce cancer. And screening is a key factor in early diagnosis and survival of cancer of the prostate. Thank you very much.
Thank you very much, doctor, for this. Make we appreciate them. It's really, really, and very, very educative, very, very helpful. For people who are there for studio, I don't know whether I get any question or how I see this. But the question where I go on as we say, you talk, say, na man only they get prostrate, but say the cancer or the disease, no be man alone they suffer them. How the what in they call them, what the drink where man take go con they catching wife.
Okay, so thank you for that. I think there's always, see, we as clinicians, when men, suffer diseases, the entire family suffers. I see, those women, very loving, coming around their husbands, being there, supporting, carrying them, and doing all the care. That is affectation.
Okay.
You may not be the ones suffering the disease, but you are suffering the effect of the disease.
Okay.
So in order for that thing not to get to you as the woman, you should advise your man, have you checked your prostate?
Okay.
So that, because if he suffers it, you will take a share of the suffering.
Now the thing even make more sense, because I can't the thing say you mean maybe the man go they suffer power failure, waist pain.
That is also part of it, sir, because impotence is a complication of prostate cancer, because the nerves that ensure there is constant power can be affected, and then there can be power failure.
So when is their duty?
Yes. So yes, so that's it. Then secondly,
no, if not that
the treatment of prostate cancer, like I said earlier, which involves removing the testes. If the testis is removed, then of course it's a permanent no. Yes, that's why we prescribe it for men in the elderly.
Now make the men way in their like that, then they resist.
Yes. So we can only we say between your life and further action, what do you want? Yes. So some will say I'd rather just die, and then it's a choice. Yes.
Person will prefer to die.
Yes, it's a matter of choice. I had a patient who I advised to take out her breast because she had cancer. She told me that, say, doctor, my breast is the loveliest part of my body. I will never do it. 3 years,
she preferred to die.
3 years after she was dead. And we got the cancer early.
I sure say that person know they properly. Sometimes informed. Informed no mean say do your best to inform them, but maybe you get fixated mindset.
It's not just that. I had to go talk to her pastor. Her pastor called her because she was educated.
She talks, say she no go.
She said she won't do. She went into some of these alternative treatment, those things that you read on the internet, natural treatment, get carrot, get this, get that, is rubbish. By the time she came out from her hiding, it has already spread.
Aye.
Yes.
Okay, make we hear from you. Give a microphone.
Ostamweke from International Institute of Journalism. Doctor, is it hereditary? That is a prostate cancer.
Thank you so much for that question. Yes. The predisposing factor, number one, is hereditary. If one's father or brother or uncle had prostate cancer, there's a higher likelihood that the person will have it. I've seen families that 3 brothers were cut down by prostate cancer. Yes, so but it's not compulsory that if one's father had it, his son must have it. But there's incomplete penetrance. It means that you can have it, your chances of having it is higher if your first degree relative have it. But it doesn't mean that you must have it. But there's a higher chance. Yes.
Okay, thank you. Ikechi Emeka for YouTube channel is say, my dad was diagnosed with this cancer. I don't want to lose him, please. And for this kind one, all they need now make them get proper attention from Hospital. Am I correct?
Yes, please.
Okay. And then Agi Nalova is a question, sir. For a family line with prostate cancer, at what age is it advised you get checked?
40 years.
40 years.
Yeah.
And Martina Agina is saying, God bless you, doctor. Everyone need to take this very seriously. I and my mom experienced this until my dad passed away. So now like that one where you talk, say, even though no be the woman getting on suffer.
Yes.
And I sure say waiting now the care side of the suffer, now she joined her mother to experience.
Yes.
And not be the other.
Yes.
Yes. And then Her Excellency Mary J. Paul, he say, I learned tones that I can literally talk about prostate cancer to anyone. Fabulous. And many, many people here, they just appreciate you, doctor. And Yetunde Adeyomo, he say, good morning, Consultant Ike. To Dr. Otabor'S, my mom's blood pressure do rise and she will then start to sweat profusely and blood to get low again. The blood to get low again. What could be the cause? Today in a prostate cancer we they talk about. If you want attention for that one, make you go to any hospital where they're near to you, where you trust. I think we go draw the curtain here today, doctor. Plenty things there, plenty questions there, but because of the matter where they for studio, we go draw the curtain